Could this be one of the main causes of your chronic shoulder pain, or help to explain why that pain continues to come back time and time again as soon as you add in your favorite lifts, especially with overhead lifts or with lifting weight out away from your body? Well, in this video, we're going to be taking a deeper dive into the balance and strength and coordination of a group of four muscles around the shoulder and the shoulder blade called the rotator cuff. When we think of the rotator cuff, we should be thinking about smaller stabilizing muscles that come off of the shoulder blade. So in this picture, we can see that we're looking at the back of the right shoulder, and this gray triangular shaped bone is our shoulder blade. And this bigger bone over on the side is the upper arm bone or the humerus. It attaches and meets up with the shoulder blade here, kind of underneath these beige muscles. And it's essentially, we'll just describe it as a golf ball sitting on a tee. Because the golf ball is so large and the tee is so small, it grants a lot of mobility in the shoulder, but it also requires a lot of strength and stability from some of the smaller muscles like the rotator cuff, as well as some of the other ligaments directly around the shoulder, in order to make sure everything moves and stays balanced and stays healthy. In this video, we're going to look at some of the common things that will happen in terms of how balance is thrown off between the muscles around the shoulder blade and how that can start to impact the mechanics of the shoulder and how the ball or the golf ball is sitting on the tee. So from this side view, which we're looking at the right side of the shoulder here, we can see one of the muscles on the, which is the front side of the rotator cuff, called the subscapularis. It attaches to the front side of the shoulder joint and comes off of the other side of the shoulder blade. And then on the back side here, we can see two out of the four rotator cuff muscles that make up more of the strength and stability of the back side of the rotator cuff. Now, there is another muscle that comes off the top here and attaches to the top of the arm bone, and that helps to form kind of a common attachment or a common cuff for all of these muscles in through here. In many cases, especially in lifters who are performing a lot of traditional weightlifting exercises like bench press, push-ups, lat pull downs, or pull-ups, and tend to do quite a bit more volume, a lot more sets in these particular types of movements versus other exercises that are working the back side of the shoulder and some of the muscles lower down between the shoulder blade and the middle part of the lower back. They'll develop an imbalance where there's too much strength and there's too much pull on the front side of the shoulder, which will cause that ball to move forward on that tee and starts to add a lot of additional stress and strain to some of the other muscles and structures on the front of the shoulder. And it'll start to stretch out some of these other muscles on the back side of the shoulder, making them less effective at actually providing support and providing balance for the shoulder joint itself. This can manifest itself in increased pain on the front of the shoulder and get increased clicking, popping, grinding of the shoulder itself, just because that ball is not in the right position on the tee. So we can see here, if we are able to get some more activation from the muscles on the back side of the shoulder and decrease some of the tension and overuse of the muscles on the front side of the shoulder, we're able to restore more balance, get the ball back into a better position on the tee, and start to decrease some of the stress and irritation of many of the muscles and structures on the front of the shoulder, and start to build up more strength and activation of the muscles on the back of the shoulder. And this can take a couple weeks just to kind of initially do a little bit of a reset in through there and help to get things calmed down, decrease any inflammation in that area. And then over the course of the next few months, we'll typically work on building up sufficient strength and control of the muscles on the backside of the shoulder and the shoulder blade to help balance out the stress, again, from the front versus the back of the shoulder, setting you up for long-term success to be able to get back into your favorite overhead lifts and eventually add additional weight and improve your overall performance.